ICL is an amazing technology. It's a Collamer lens implant that we put inside the eye without removing your natural lens. So with refractive lens exchange and cataract surgery, I'm removing your natural lens and putting a new lens in its place. But ICL is a technology where think of it as putting like a contact lens inside your eye that stays in there permanently until we decide to remove it. So it's reversible. Otherwise, it sits in the eye. I generally recommend doing ICLs in patients who have a high level of nearsightedness, who don't want PRK. We talked about PRK earlier, and the slow healing process of PRK. And so some patients are like, you know what, I can't do the downtime. I say, well, I have this great technology called the ICL. It's about a 10-minute procedure per eye. You're seeing 20/20 to 20/40 the very next day. It's a high definition lens. My patients love it. And so we do offer that, but it is, again, more costly because we have to go to the operating room. There's an anesthesiologist present. And so all those things add to the cost of getting the ICL done. The other advantage of ICL is that it can treat nearsightedness and astigmatism, but not farsightedness. And it actually doesn't have any impact on dryness of the eyes. So if some patients come in who have really, really dry eyes, I might recommend ICL to them because I'm not going to change anything on the surface of the cornea, which could change if you were to do a laser vision correction procedure. We can even do ICL with great results in keratoconic patients. So patients with irregular corneas that should never have a laser vision correction surgery, we're having actually quite good results offering them the ICL technology.
Do you find that that's able to get them away from using scleral lenses, is by putting an ICL in?
It has, yeah. We've had patients be very successful ICL patients in offering them to the keratoconic population. Now, some patients, of course, you want them to get cross-linked to make sure the cornea is stable, that sort of thing. But if their cornea is stable, yeah, we're getting great results with it.
And how many years of data now is there on the ICL technology?
So the ICL's been around, I want to say, since 2005, roughly. So it's been almost 20 years. They have the latest iteration of it came out a couple of years ago that has a small hole or opening within the lens that allows for the flow of fluid from the back of the lens to the front of the lens. That's an advantage for the fluid movement within the eye, and that's helped to get us better outcomes with patients as well. So yeah, almost 20-year results. They've been wonderful. The #1 user of the ICL in the country, in the US, is US military. So we know it's battlefield tested. So I offer to patients who are very active, for sure.
That was going to be my next question. How does profession, like obviously a football player coming to you versus, that's, high risk of trauma, versus, someone who is in an IT firm and they're just in front of a computer all day. Like, how does profession weigh into your discussion with the patient in terms of recommendations from patients who are really likely to suffer trauma, versus those who are really unlikely to suffer trauma?
For instance, I have two potential patients to talk about. So one is, let's just say you're a mixed martial arts professional who comes in to see me, and you're worried about getting hit in the eye in the course of competing. So I'm certainly not going to give you or offer you a procedure that's going to be at risk for something moving. So I've offered SMILE laser eye surgery to those patients because I know the cornea is going to be more stable, and they're going to be able to see their opponent that's attacking them and defend themselves and have a good outcome, not worry about getting hit in the eye. There's another type of patient who could be like a sharpshooter for the Secret Service. And that patient, again, looking at all the different options available to them. But one of the things that we didn't talk about yet is doing custom Lasik surgery for patients, which is where I have a device that can take a fingerprint of the cornea, literally, and we treat that fingerprint for the patient specifically to help them get better vision than 20/20. And so the studies have shown that, and the technology is called Contoura. The studies have shown that you can get 20/15 vision or better in 40% of patients who undergo that technology. For someone like that, I'm going to say, let's offer you, even though you qualify for SMILE, and I love SMILE, I think for that particular patient, offering them wavefront or custom Lasik could be the better option for them.
Is custom Lasik done with the same laser, or is that yet another laser that you have to buy?
Yeah. It's done with the same laser, but there's a different diagnostic equipment that we have attached to it. And so the same laser can do two different types of treatment.